A 38-year-old woman. Since after Dōng, for nearly 1 month, whenever the sun came out, she felt a stream of heat surging upward from within her body, attacking her head and face. Her face turned red, as if she were drunk, and the heat in her head became unbearable. One morning a week ago, she suddenly felt a rush of heat attacking the head and face. The right lower jaw suddenly felt as if it were struck by electricity or burned by fire, with waves of severe pain shooting to the right shuì. Each attack lasted about 3 to 5 minutes and occurred more than 10 times a day. The pain started at 5 a.m. every day, intensified significantly at 12 p.m. noon, and began to subside around 5 p.m. The pain completely ceased after sunset. During the night, she felt completely normal. She had dry stools and a dry mouth. Curiously, her entire body was warm, but her 2 knees were icy cold to the touch. She suffered from difficulty falling asleep. Her pulse was Hóng Dà, surging and large, but lacked strength. Her tongue was red with no tongue coating. The physician considered that the patient suffered from an insufficiency of internal fluids. Without sufficient fluid to restrain it, the internal heat rushed upward unchecked. The doctor also believed that the internal heat would be intensified by the surrounding environmental heat, which explained why the pain worsened at 12 p.m. every day and stopped after sunset. The treatment required supplementing the internal fluids, restraining the upward rushing heat, and guiding the heat back into the body. Prescription: 1-day dosage. Romania root prepared, shuì, 90 grams. Morinda root, bā-ji, 30 grams. Asparagus tuber, tian-dong, 30 grams. Ophiopugan tuber, mai-dong, 30 grams. Poria, fuling, 15 grams. Schismandra fruit, wu-zi, 6 grams. White peony root, bai-xiao, 100 grams. Honey-fried licorice root, jiǎng, 30 grams. And kudzu root, geigen, 60 grams. All these herbs were mixed and decocted into a soup. The resulting liquid was divided into 2 doses to be taken throughout the day. The doctor prescribed a total of 3 days of medication. Second consultation. After the first day of taking the herbs, the upward heat attack was greatly reduced. On the second day, the heat stopped surging and the pain disappeared. There were only a few brief attacks between 2 p.m. and 3 p.m. His pulse became calmer, his facial redness faded, and a thin white coating appeared on his tongue. The doctor gave him another 3 days of the same formula. After finishing all the medicine, the illness was completely cured. A follow-up 3 years later showed no recurrence. Hence, Ti-shi, Dōng, winter solstice, one of the 24 specific solar terms in a year. The time point of Dōng falls between December 21st and 23rd each year. Shuì, an acupuncture term. Its location is in the temporal depression on both sides of the head, behind the eyes. A question for discussion. Sukao. The patient's symptoms started after Dōng. The physician did not explain the reason. The audience can ponder this question.